the occurrence of more cases of a disease than would be expected during a community or region during a given fundamental measure. A sudden severe outbreak of a disease like SARS. Also we call it the pandemic. On January 7, 2020, Chinese health authorities announced that they'd isolated the virus spreading in Wuhan. This novel coronavirus was named initially spoken as 2019 Gov and was also called Wuhan coronavirus because the primary infected people came from Wuhan City, Hubei Province in China. A city of quite 11 million people and a significant transportation hub. On February 11, 2020 the disease was officially named COVID-19, then the virus that causes it, officially named SARS-CoV-2. This virus resembles other serious human coronavirus types MERS and SARS, therein all belong to the beta subgrouping of virus. The CDC notes that MERS and SARS both began as infections in bats before mutating to infect humans. COVID-19 symptoms may begin a touch just like the flu but persist to develop fever, cough, and shortness of breath that's severe enough to warrant hospitalization in many patients. Unfortunately, to date, there's not any antiviral or vaccine to treat this infection. Symptom relief and supportive care, many requiring hospital care, are this treatment methods. However, early supportive care may reduce the disease severity. According to the CDC, some infected people have few or no symptoms, whereas others is also severely ill or die from the disease. Initial estimates suggest symptoms begin after exposure from 2 to 14 days with a median of 5 days. This is a category of virus that's known to mutate easily. Prior mutations led to the 2002 to 2003 SARS outbreak, within which a scourge native to civet cats mutated to spread the illness to humans. In Saudi Arabia in 2012, a coronavirus that infected camels mutated to become infectious in humans, resulting in the MERS outbreak. Currently, researchers haven't discovered the initial source of the COVID-19 coronavirus, but they think it came from wild animals killed and sold for food. Health experts widely agree that several infected patients had some association with an oversized live animal seafood market in Wuhan City, suggesting the disease was first spread from animal to human contact. Human-to-human transfer was soon confirmed in China, South Korea, Italy, Iran, the USA, and eventually around the world. The first person to be infected within the US was an Illinois man in his 60s. His wife became infected while traveling in Wuhan, China. The virus spreads mainly from person to person by droplets produced by coughing and/or sneezing. Occasionally, it's transferred to people after they touch a surface contaminated by virus-containing droplets. Some people can spread the infection without showing symptoms. Authorities from China confirmed the identity of the new virus on January 7, 2020. And commenced working with the WHO on the identical day to be told more about the virus. Chinese authorities have reacted to the virus outbreak with an unprecedented lockdown of Hubei province. The travel restrictions affect several people in cities, airports, public transportation, workplaces, and schools are packed up to prevent further contagion. As of March 17, 2020, the quantity of COVID-19 has markedly reduced, and so the Chinese are dismantling their emergency hospitals. Countries around the world have taken steps to prevent the further spread of the COVID-19 virus. Screening goes down at airports, events are being cancelled, schools are closing, public health officials are urging people to avoid public spaces the utmost amount as possible. And self-isolation/self-quarantines and social distancing practices are happening. With the large outbreaks that have followed in Asian country, Europe, especially Italy, and now the USA, officials hope that the practices being put in place will help educate the final public and slow the spread of this emerging disease. As a newly identified virus, COVID-19 has no specified treatment. Supportive care is that the treatment, an oversized number of patients, about 16 to 20%, need hospitalization to induce appropriate care. Work is underway to develop antiviral medications to combat the illness. Meanwhile, the CDC says that healthcare workers should strive to treat the symptoms of an infection through supportive care. Researchers are trying to develop a vaccine against the virus. Based on advice gathered from previous coronavirus outbreaks, the WHO offers general guidance about the way to prevent COVID-19 virus infection. Keep your hands clean frequently with either soap and water or an alcohol-based rub. Cover your mouth anytime you cough or sneeze. Throw away used tissues. Avoid spending time around folks that have a fever or cough. If you show symptoms of the COVID-19 virus, cough, fever, shortness of breath, tell your doctor instantly, and fill your doctor in on your recent travel history. If you visit an animal market where a coronavirus outbreak is suspected, avoid animals and any surfaces they will have touched. Make sure any animal material you utilize in meals is fully cooked. Handle meat carefully. In addition, the CDC recommends you avoid visiting areas where there's a scourge of this infection and to avoid any close contact with anyone who has visited the outbreak area or shows signs of the infection within the last 14 days. Social distancing of a minimum of 6 feet is additionally recommended. So far, no vaccine has been developed for this newly discovered virus. On January 28, the U.S. Department of Health and Human Services announced that the National Institute of Health has begun to collaborate on the event of a COVID-19 vaccine. Early trials have begun, but it'll likely take a year or longer before a secure, proven vaccine are often released to the general public, in line with HHS officials. The National Health Commission in China is collaborating with various health organizations, including the Globe Health Organization, WHO, to further study how severe and the way contagious this virus is also. By sharing data and continuing to review the illness, health researchers worldwide hope to contribute to the event of a vaccine. So when this pandemic ends,